Hi, everybody. So for today's lecture, we're covering a very important topic, which is sepsis. In particular, we're going to be addressing how to identify a patient with sepsis and what nursing interventions we will need to treat a patient with sepsis. So before we begin, it's really important for us to understand what is sepsis. Sepsis occurs when an infectious agent causes a dysregulated immune response in the body. What this means is the body's typical immune response becomes systemic. It's happening all over. The diffuse immune and inflammatory response that's happening is going to result in a number of things: vasodilation, coagulation, and increased capillary permeability. And all of these are going to result in a maldistribution of blood flow and decreased tissue perfusion, which ultimately can lead to organ failure and death. So before we begin, it's important to understand when we're caring for patients who are going to be our high-risk patients for developing sepsis. Our high-risk patients can be immunocompromised patients, those with advanced age, anyone with indwelling lines, drains, so catheters, PICC lines, IVs, any patient that's undergone a recent invasive procedure, or any patient that has a current infection. So what we're going to look for with our patients that might indicate that they're developing sepsis is we're going to see changes in vital signs and the patient's clinical presentation. In particular, one of our first signs is going to be an elevated respiratory rate. In addition, we may see elevated heart rate, an increase or a decrease in total body temperature, hypotension, and change in mentation. So your patient may become confused, agitated, or anxious. We're also going to see changes in their blood work, in particular an elevated white blood cell count, elevated lactate. Patients will often have positive blood cultures from whatever infectious organism that is likely traveled to their bloodstream. They may have an elevated procalcitonin, elevated glucose, and other electrolyte imbalances associated with the metabolic changes that their body goes through when fighting this infection, and a possible decrease in their platelet count. So when you see a patient that's showing this constellation of signs and symptoms and you think they may possibly have a sepsis infection, it's important to first think through and try to identify where the possible source of infection is. So do they have a line, an indwelling catheter, a wound, a recent infection, anything that might point you to where your infectious source is? Then we're going to want to begin rapid fluid replacement. And our initial formula is we're going to need 30 milliliters per kilogram per hour. So rapid, high volume fluid replacement. It's important that we also collect blood cultures right away to identify what possible organism is causing this infection and help us streamline our treatment. We were also going to want to take samples from any possible sources, so urine samples, wound cultures, sputum cultures, etc. Other diagnostic imaging will need to be done right away, so that can include chest x-rays, lab work. We mentioned we're going to look for those inflammatory markers that can indicate sepsis, lactate, procalcitonin. And once we've completed all that, we want to begin broad spectrum antibiotics right away. So we're going to work on the assumption that the infectious organism is likely bacterial until proven otherwise. So early intervention, starting broad spectrum antibiotics right away. We're going to want to begin oxygen delivery as well. This can help with patients that are having a change in their respiratory status, and then temperature management. So either cooling or warming blankets, depending on the patient's body temperature. And these patients are likely going to require increased monitoring. So ECG monitoring, frequent vital signs assessments, and a lot of patient and family education about how to proceed. Then we're going to want to evaluate our initial response and see how the patient's responding. So we're going to want to look at their cardiovascular status. Did the patient's blood pressure respond to fluid replacement? We're going to want to look at their respiratory status. If they're still having an elevated respiratory rate, it's likely due to their body trying to compensate for the metabolic acidosis that comes from a change in perfusion. We're going to want to look at the patient's neurological status. Are they still alert, oriented, responsive, or are they getting more confused and more lethargic? We're going to want to continue trending any abnormal lab results, and we're going to want to monitor for progression of symptoms indicating that they're going into organ failure and that the patient may require a higher level of care. So I know this is a complex topic. If you have any questions, feel free to reach out. This is something that we will continue to address ongoing throughout the semester. So if there's anything you want me to follow up on, again, please feel free to reach out.